Hey guys, welcome back to FearlessRN. So for today I will be talking about prioritization, which is really important in nursing and on NCLEX. In nursing, we are continuously setting and evaluating priorities in order to meet the needs of our patients and provide optimal patient care. What are some things that you as a nurse may have to set priorities for? It can be, which client or patient do I need to see first? Which assessment do I need to complete right away? Which interventions definitely must get done? It is very important that in the healthcare profession, communication is adequately done, because communication is very, very important. There are a few words that you should look for while dealing with prioritization. The first thing I'll mention is systemic versus localized. Systemic means that there is something that affects the entire body, whereas localized is something that affects a specific part of the body. Maybe right here in my upper shoulder, there's some injury right there, so it's localized to one area. So with that, which one, systemic or localized, would require you to prioritize as number one? This one. Acute versus chronic. So acute is something that happens suddenly. It's just random. Whereas chronic is a long-term, progressive type of disease or situation going on. So which one would you say takes hold of the highest priority? And it's also very important to remember that in certain diseases, there are some signs and symptoms that will come up as acute, and you really need to pay attention to that. Whereas there are some chronic signs and symptoms that you need to pay attention to, that if they are sudden but chronic, you need to pay attention to that. It's all about the timing when you're thinking about prioritization, what you should pick or which patient you should see. Actual versus potential. Actual is something that is actually happening right now. Right now, this very moment, something is going on with your patient right now. Whereas potential is something that could happen if you don't do something, or that will happen with time. And it could cause more difficulties or more detrimental side effects to your patient. While thinking of prioritization, I'd like to say this is very important to pay attention to the lab value trends. There are some lab values that you really should know for NCLEX. And while you're in the hospital, it's very important to pay attention to your patient and know which lab values for your patient is normal for that individual or consistent, and which may indicate that there's a decline in the way your patient is holding up. So it's very important to see what is normal for your patient compared to the normal values. It is important to recognize the signs and symptoms and identify whether or not your patient's getting better or worse. So while I was doing my NCLEX exam, I read through numerous resources talking about the Maslow Hierarchy. Now, if you haven't heard about that, please look it up, because it's very important when thinking about what is considered a priority. I'll leave a diagram right here so you can see. So just an example, safety would be more important than someone who's looking for love and belonging, because you got to be safe in order to get that love and belonging. Another thing that was drilled in my head while studying for my NCLEX was the ABCs. Now that stands for airway, breathing, circulation, and there's also a D, which is called disability. It's important to know the ABCs because it's necessary to sustain life. You need an open airway to maintain your body functioning. You need to be able to breathe to obtain adequate oxygenation, and you need adequate circulation throughout your body to get the blood flow and nutrients throughout your body. So they all go hand in hand. A, B, C. And if you want to add in disability, it's basically as a prevention for any disabilities. Pay attention to the client's clinical manifestation to see how they are progressing in the disease process. Is it getting worse or is it getting better? Another thing that comes to mind when thinking about prioritization is safety. Remember that in nursing and on NCLEX, it is all about safety. How can you be a safe nurse? That's what NCLEX wants to know. You always want to assess for anything like bleeding, injury, airway obstruction, hypoxia, and infection. You always want to pick the risk that will cause the most harm to your patient. Alright guys, so that concludes this video on prioritization. I hope that you found it informative. I'll be glad to clarify anything that was discussed in this video. And please stay tuned for upcoming videos that are coming really soon. I apologize for my absence. If you were following me on my Facebook, Instagram, and Snapchat, you'll know why I've been absent. I'm going to continue to push out these videos for you guys. So please let me know what you'd like to see next. And I'll see you guys in the next video. Thanks to everyone who's reached out to me to let me know that they recently passed their NCLEX. So thank you guys for letting me know, as well as including me in your journey. Please look down in the description box where I will include a corresponding blog post with this video. And I may include additional information such as keywords that you need to know and maybe some sample questions. So please check the link down below, and I hope that they're helpful for you. So good luck to everyone and stay blessed. Bye.
Yo, B, they ready.